You should be familiar with the two people shown here. One is President Xi Jinping. The other one is Britain's Prince Charles. Although their age difference is only 1 year, there is a lot of difference in their appearance. Hair is a very important factor that makes one look young and fit. Many people are under considerable stress because they don't have hair where hair should have been present. The picture on the right shows the results 1 year after hair transplant. You can notice that it has improved considerably. Let's take a better look at hair transplantation. Hair transplantation can be performed using FUT and FUE, depending on how the hair follicles are collected. A hair transplanter can be used, or transplantation can be done by creating a slit, depending on the transplantation method. We'll focus on how hair follicles are collected. With FUT, after the donor area preparation, donor strip harvesting and suture, a team of trained and skilled medical technicians collect the hair by separating them into follicular units. With FUE, the hair is extracted by a handheld motorized device or by using an artist robot. With FUT, the quantity of hair that can be harvested is large, and it causes less damage to the hair. The hair survival rate is great, the operation time is short, and the cost is cheaper. As you can see from the photo, a single disadvantage of FUT is the scar that's left on the back of the head after surgery. A scar like this may occur if an excessive amount is harvested from a person whose scalp is very tight. If an extensive scar is left behind, we will treat it after the scalp becomes softer over time so that it becomes less visible. Does the scar appear too large? Let's look at another case. Leaving a scar of this degree is possible. Even if the scar appears larger than this, it will not be visible if it's covered with the hair on the back of the head. FUE is said not to leave a scar and causes less pain. It is also said that it allows for a faster return to normal life, with good hair survival rate and less swelling and discomfort. However, that's not always the case. Let's take a look at it. Although FUE is thought to not leave any scars, such scars occur in reality. Next, we will talk about the quantity of transplanted hair, which is a very important aspect to consider. First, FUE is said not to leave any scars, which is the biggest disadvantage of FUT. For this to happen, each hair should be removed one by one, horizontally and vertically in alternation. In other words, only one hair is extracted for every 4 hairs. This means that in order to collect the same quantity as when you collect hair from a strip, 4 times that area is required. If you pull out 1 for every 2 hairs, it means that 9 times the area is required. In order for the hair to be able to be well maintained for a lifetime, it should be extracted within a safe area. According to some studies, the size of the actual safe area is 168 square centimeters. With FUT, only 50 square centimeters is required to extract 5,000 hairs. But with FUE, it requires 4 times that area. 200 square centimeters is required. Therefore, in order to get the same quantity, you must go over the safe area. And this means that the quantity will decrease if you collect within the safe area. In conclusion, in FUE, to collect the same quantity as FUT, hairs need to be extracted over a larger area, because in FUE, at least 4 times the area must be anesthetized compared to FUT. The pain caused for the same quantity of transplanted hair by FUT will be less, but not more than FUE. For FUE, the hair length should be shortened to 2 to 3 millimeters by shaving. Since shaving is required, the return to normal life will take more time. From this point on, we will discuss a very important detail: the effect of hair follicle damage on hair transplantation results. It stands to reason that the survival rate of the transplanted hair will be reduced if damage occurs. After shaving, it is more difficult to judge the hair follicle directions prior to hair removal. It's possible for hair follicles to be damaged if the directions are judged incorrectly when collecting the hair. Therefore, if you punch by judging the direction by its outward appearance, the hair root, which allows generation and growth of hair, will be damaged. This is a photo of hair follicles completely cut off after collecting them by FUE. This photo is that of a triple hair follicle which people who do FUE talk about. In such cases, some says that the collected number of hairs is adequate despite of the small number of the punched hair follicles. However, as you can see in this case, the size of the punch used to collect hair is smaller than the width of the follicle. With this, damage can occur around the follicles. You may use a larger punch to protect hair follicles, but severe bleeding will occur and it will make surgery difficult. Scars like small dots can occur a little wider on the scalp, and this is a source of concern. Next is damage due to pulling. Pulling with a punch, as if you're pulling out radishes and carrots, will result in a high probability of tearing damage. Although hair follicles can be pulled out easily with regard to hair density, the surrounding hair follicles can be damaged. This is a photo of collected hair follicles. Even if the upper photo shows follicles with the hair bulbs and hair papilla protected adequately by adipose tissue, I consider that a successful surgery is only possible if the hair follicles are protected and separated well like trees, with well-preserved roots. Please take a look at this picture for a moment. Which tree do you think will survive well? I believe that the tree on the left, which is transplanted with its root parts well preserved, will survive much better. You can consider the left one as hair follicles separated by FUT, and the right one as hair follicles pulled out by FUE. When a scar forms, there is a phenomenon called scar contracture, for which the surrounding tissue is deviated. Thus, reoperation, or third surgery, becomes difficult. In FUT, since the scar forms a single line, the surrounding hair follicles will only pull in that direction. Therefore, during reoperation, incision and separation can be done while predicting the direction of deviation, while directly looking at it, and also damage to hair follicles is reduced. The hair survival rate of FUT performed by experienced doctor and medical technicians is about 90%. Although FUE is said to have the same survival rate, I have great doubts in that number due to a lot of variables. Swelling and discomfort that occur after surgery come from the recipient's site, not from the donor site. Therefore, the discomfort that results from FUT and FUE is the same. With FUE, the doctor needs to repeatedly punch and transplant. Therefore, the time taken for FUE is much longer. The doctor gets more tired due to the prolonged operation, and thus the cost is high due to longer operation time. Whereas with FUT, it only takes 30 minutes for the doctor to separate the strip. The doctor can take a rest while the medical technicians separate the hair follicular units. When the separation is completed, the doctor transplants the hair. Thus, with FUT, it is possible to transplant a large quantity of hair, and survival rate is high due to less damage to hair follicles. The cost is cheaper because it's more convenient for reoperation, and operation time is comparatively short. It does not mean that FUE does not have any merits. In cases where the scalp is originally hard or if the person already had 2 operations, it is impossible to transplant enough hair with FUT because the scalp is low in elasticity. FUE is advantageous when only a small quantity of hair is needed. If the patient chooses FUE, even after he or she has been informed the details on the difference between FUE and FUT, FUE will be applied. Let's look at other types of hair transplant procedures. Since density is important for hairline, FUT, which results in a high survival rate of hair follicles, is applied. Since the hair directions and curls should be aligned precisely to avoid any folliculitis when performing hair transplant for eyebrows and pubic hair, FUT is considered to be the appropriate method rather than FUE, that transplants short hairs collected after shaving. It's a choice between FUE, which produces average results, but without a scar line, and FUT, which produces great results, but with a scar line. In other words, FUT or FUE, it is a matter of choice. We hope that this has made choosing the right transplant method easier for you. Thank you.